Hello and good morning, dear friends, ladies and gentlemen. It gives me great pleasure to welcome you all to this 34th edition of our webinar. It's great to see you all online on Sunday morning. The primary motivating factor for us to participate in this webinar is to share ideas, develop plans and strategies that will make our entrepreneurs the best. Webinars are amongst the best networking platforms available for businessmen in this digital age. One of the main reasons why entrepreneurs from AABN should seriously consider making use of webinar services is the fact that they help increase the amount of content available to interested parties. At AABN, every webinar we host help address common questions and concerns harbored by our entrepreneurs. Though through these weekly webinars, AABN ensured accessibility to a global audience. At AABN, we understand that networking is an important experience that should not be lost during a vital event. The COVID-19 pandemic has proven to be more than just a threat to our health. It's become a disruption of our way of life, affecting everything from supply chains to what is considered essential work. COVID-19 pandemic has revealed how interconnected our health is with the health of those around us, as well as highlighting systemic inequities that affect the well-being of entire communities. COVID-19 has shed light on the importance of mental health and raised questions about how immune systems work. COVID-19 is more than just a physical illness. Inaccurate and incomplete information spreads just as rapidly around the globe, complicating efforts to contain the virus and keep communities safe and healthy. Sharing knowledge in times of such crisis is part of AABN mission. The use of masks is part of a comprehensive package of prevention and control measures that can limit the spread of COVID-19. Masks can be used for protection of healthy persons or for source control or both. In theory, cloth masks can be helpful to limit the spread of COVID-19. Serious consideration should be given to the choice of textile, the number of layers of cloth used, pre-treatment of the material with water repellent material, and other compounds that can enhance the filtration efficiency of the mask without compromising the breathability. Dr. Anusuya Roy uses concepts of engineering and the theoretical principles of filtration and have recommendations to improve the quality and safety of cloth masks for the general public. Ultraviolet C radiation is a known disinfectant for air, water, and surfaces. UVC lamps are often called germicidal lamps. Cleaning and disinfecting are critical to reducing the risk of transmission, but is there another step that we can take? Mr. Vardhamam Jain will deliberate on infection prevention using ultraviolet. He will focus on different technologies, implementation and operational considerations, and strategies for safe and effective use of technology. We have in our midst two awesome speakers with fresh perspectives. Given the backgrounds, Dr. Anasuya Roy and Mr. Vardhamam Jain are most suited to talk about pledge against COVID-19, universal masking, and its role in containing the pandemic to address this. Let us extend a very warm welcome to our eminent guest speakers and introduce them to you. Dr. Anasuya Roy is the founder and CEO of Nanosip Solutions, a healthcare technological startup incubated at IIT Delhi. She is a recipient of prestigious biotechnology ignition grant in its 13th call, sponsored by Biotechnology Industry Research Assistance Council, the industry research wing of Department of Biotechnology, Government of India. Under this project, she translated her doctoral research work into multiple commercially viable market-ready applications. The nature of the products and solutions developed by her and marketed by Nanosafe is the first grade of a polymeric nanocomposite material based on active copper as the antimicrobial agent to be introduced in the global market. NSafe mask, which is 50 times reusable neutralizing mask, was also developed during using active copper as a coating material. She is also a recipient of Department of Science and Technology Nidhi Seed Support Scheme for exemplary work amidst lockdown times, contributing to containment of COVID-19. Dr. Anasuya had completed a PhD from IIT Delhi and doctoral dissertation on applications of nanotechnology in polymer systems for optimized antimicrobial and cytocompatible behavior with a focus on metal-based biocides and the toxicity behavior. Her thesis won 8 awards, including international awards at University of Melbourne, Australia, IIT Open House Award, and IIT Industry Day Award. She completed her MTech in 2013 from IIT Delhi in collaboration with the University of Stuttgart, Germany, as a DAAD exchange scholar. She has 13 publications in peer-reviewed journals, 18 conference papers, and 4 technology patents. She has also won DMA All India Women Entrepreneurship Award 2021 for exhibiting outstanding leadership skills within the first year of incorporation of a company. She is an ardent promoter of indigenous technology on a global platform and covets to become the first supplier of antimicrobial active copper-based solutions across globe. As head R&D at Nanosip Solutions, she focuses on development of nanotechnology, imbibed antiviral and antimicrobial innovations suitable for textile and polymer industry that are ergonomic, safe, and sustainable. Vardhaman Jain is a young, dynamic senior technology leader, highly focused, result-oriented, and proven record of deliverance in a multicultural, multinational environment, and has successfully led technical, general research management, organizational transformations. Vardhaman brings in unique combination of leadership and technical skill sets, managing ultraviolet range of products. Vardhaman grew up in Rajasthan. After the bachelor's degree in engineering from Jaipur Engineering College, he pursued his master's in business studies from ICFA University. He then joined Philips Lighting. Over his career journey, Vardhaman has worked in various marketing leadership capacities. Vardhaman is currently the General Manager, Category Head for Ultraviolet Solutions in Signify Innovations, erstwhile Philips Lighting, a technology prospecting consulting arm focused on lighting, IoT, and UVC business. The company is working on several innovative product lines addressing IoT-based platforms, lighting, and UVC solution globally. Company is focusing on providing safe and hygiene atmosphere to its customers. On behalf of AABN, I welcome each one of you attending this webinar for understanding how critical this issue is and making time to be here. I hope you all will make the best use of this webinar, which is not just timely, but can have a telling effect on the way we handle the issue of COVID-19 in the coming days. Hope you have a very engaging and enriching day. Thank you, and over to Dr. Anishwar Rai.
A very good morning to one and all. I'm very happy to see so many people turned out on a Sunday morning, which is normally the time we take we have our leisurely time. We normally watch television or be lazy at home. But it gives me utmost pleasure to see that so many people are here to talk about a very heavy a topic which is very relevant and very persistent and very important while we are all fighting the COVID-19 pandemic. Thank you, Mr. Gopiji, for introducing me so nicely. It was a wonderful introduction that you gave about me. So give me a couple of seconds to share my slide here. I hope my screen is visible.
Yes, you can make it full screen. Yeah.
Great. So the topic on which I'm going to talk today is something that is very closely related to my heart, something that I have been working very closely with, associated very closely with, and something that is all necessary for us to contain the COVID-19 pandemic. So I'm going to talk about universal masking and the role it has in preventing the chain of transmission of COVID-19 virus. So again, I'm Dr. Anasuya Roy. I'm the founder and CEO of Nanosip Solutions. Nanosip Solutions is an IIT Delhi incubated startup. And we started this startup before COVID-19 times. We were working in the area of antimicrobial nanocomposites for plastics and textile applications. And it was then that the COVID-19 pandemic hit us. And because we were already working in an antimicrobial kind of a space, we were quickly able to diversify our portfolio into making masks, which are antimicrobial in nature. So I'll talk about our masks and how the science behind masking and how it contains the pandemic in my subsequent slides. Let me begin this presentation with two beautiful quotes by two of our wisest men. Mr. Mahatma Gandhi ji, he said that it is wealth that is real wealth and not just pieces of gold and silver. And I think this is something that we should all agree with. that health is our greatest wealth. And it is, as the Dalai Lama said, happiness is the highest form of health. Health is something that should not be neglected, and health is something that should not be compromised at all. And yet we are here, we are facing a global crisis, a global pandemic that has wrecked us, not only our lives, not only our lifestyle, but we have also lost many near and dear ones in the past 1 year. So let us pray that the situation improves and we are able to steer out of this pandemic as soon as possible. So I'll talk about a little bit about the science behind the pandemic, how pandemic started and what causes pandemic, etc., etc. So let me begin with a small introduction. So we are fighting the COVID-19 pandemic for the past 1 year. It has been more than a year actually that we are amidst this pandemic, and there is a huge implications. There has been huge implications on our life and lifestyle because of this pandemic. And as a global community, we must stand together in fighting the pandemic. We should come together as states, as continents, as countries together to contain this pandemic and break the chain. There has been, of course, a lot of loss of lives. There has been financial insecurities, especially for daily wage workers who are earning their bread and butter daily. Having said that, there has been some positive effects as well, especially on the environmental side. Carbon emissions have definitely gone down, which is a good thing. Also, wildlife is seen at some parts of this world which is not really anticipated, and these are the kind of positive effects that we have seen on the environment, and this is something that we should learn how to tackle it and how to behave better with our world to enable a more sustainable and a long-term impact of the environment. So let me begin with a question. So are pandemics new? So is the COVID-19 pandemic the first pandemic that we are facing in the history of mankind? So what I'm going to do is I'm going to make my presentation and make my this particular session very interactive, so that you can ask question, you can type in the chat box, and I'll be happy to answer any questions that you have. And I'm going to talk about the science or the background story behind the pandemics and masking, etc., so that it gives a more general and clear perspective about what we are facing as of now. So let me differentiate pandemic from epidemic first. So epidemic is something that is kind of restricted on a geographical location. So this is a disease that affects a large number of people within a community, population, or region, but it stays within that particular geographical threshold. And pandemic is also an epidemic, but it kind of spreads over multiple countries or continents. A pandemic takes place when there is an increased connectivity between countries or continents, which is exactly what we are facing now. There has been huge flight connections. There have been, people traveling from one country to the other, and that is why we are facing a pandemic. So we used to face epidemic before. So when was the first epidemic reported? In fact, you'll be very surprised to know that as early as 16th century BC, we could find an epidemic of plague. Plague was the epidemic at that point of time, and it was depicted in the Greek author Homer's classic mythological book Iliad. So we are not facing pandemic new. Epidemics and pandemics have been part of the global community before as well. And after that, we have faced a lot of epidemics post that. For example, one of the most famous epidemics had been Bubonic Plague, which was wreaking havoc in Europe and Asia in the 13th and 14th century AD. And the transmission route of this kind of plague was also because of the infected respiratory droplets from an infected person's mouth or nose, same that as of the COVID. Of course, the vectors were also involved. For example, rats were the vectors of transmitting this viruses. And at that point of time, there were not many people who understood the science behind transmission of this kind of epidemics or plague, and they kind of resorted to using barbaric kind of methods to stop the spread of the pandemic, which kind of led to widespread fear and abandonment and superstition, etc., etc. A small trivia. the word quarantine that we use so frequently nowadays actually stemmed from this period. So these were kind of spreading through ports. Like in COVID-19, we see that it's spreading through flights which travel from one country to one continent to the other continent. At that point of time, flights were not there, so there were kind of connectivity through seaports. So this they were able to understand that this pandemic was spreading through the port cities. And what they used to do as a precautionary measure, whenever there is a ship which is being docked at any Europe city or country, they used to isolate that ship for 40 days. So that was the normal norm there to contain the spread. And the term quarantine is from the Italian word quaranta giorni. Quarantum is 40 and giorni is days. So 40 days or quarantine was used at that point of time, and the term quarantine was kind of taken up from that period. Moving forward, we had many recent pandemics in the past. For example, exactly 100 years from now, we had a huge epidemic of Spanish flu, which was caused by influenza type H1N1 virus, which is one of the most potent viruses till date. We also had the swine flu pandemic. This was also an influenza type of viruses which wreaked havoc in the 2009-2010 period. Then we have the very famous Ebola epidemic, which was there in the Western African hemisphere. Talking about the coronavirus family, we also had two previous ancestors of SARS-CoV-2, which is SARS virus. The first SARS virus or coronavirus was found in China in as early as 2003. And then the virus mutated and became MERS, MERS being Middle East Respiratory Syndrome. This originated in Korea and spread to Middle Eastern countries of Saudi Arabia and UAE in 2012. So having said all of this, let us understand how COVID-19 or the SARS-CoV-2 virus, which is the causative organism now, is different from the rest of the viruses. So understanding the SARS-CoV-2 virus, it is covered by spike proteins on the outer layer, and it is a highly contagious virus. So contagious or non-contagiousness of a virus depends upon the basic reproduction number. For example, from one, how many are infected from one infected individual. So the basic reproduction is 1.4 to 7.2, and the average is 2. For example, if one infected person of SARS-CoV-2 is there, he will be able to inoculate or infect 1.4 to 7.2 of other individuals. So that is how the reproduction number is determined. In fact, as we are talking today, we are facing the second wave of SARS-CoV-2 virus. And in fact, this virus is suggested to be a mutated strain of the original SARS-CoV-2 virus. In fact, and the basic reproduction number is not yet put a value to it. WHO is trying very hard to assign a value to the basic reproduction number of the mutated strain, but it is assumed to be higher, assumed to be more contagious than the original strain of the SARS-CoV-2. Well, the transmission routes of this virus we have, kind of has been well established, but let me talk about it. So the basic transmission happens through respiratory aerosols, which escapes from the mouth and nose of an infected person. And this can be airborne as well. This can stay in air for as long as 8 hours to 24 hours time period, depending upon what kind of air circulation that particular space has. Also, there can be chances of direct and indirect transmission. Direct transmission meaning whenever the infected person touches another uninfected individual, for example, handshake or touching any part of the body. So that is a form of direct transmission. And indirect transmission meaning that person touches, the infected person touches an inanimate object, for example, table or chair or bed railing or whatever, and then another uninfected person touches the same surface. So that is why there is a protocol of sanitizing surfaces and not to touch unnecessarily all the surfaces. So that is the indirect route of transmission. Having said that, the best prevention is of course a full-fledged vaccination program. But it will take time. Government is working very hard in putting these protocols in place. But till the time all of us is not vaccinated, of course, the efficacy of vaccine is another huge debate which is ongoing. case identification, tracing and isolation is a very effective method in breaking the chain. So that is why we have curfews, we have night curfews, we have lockdown just to break the chain. Um, and in addition to all of that, there has been mandated social protocols so that the rate of transmission of the virus is reduced drastically. Social distancing, maintaining a distance of 2 feet from each other, uh, is necessary because it is assumed that respiratory droplets cannot travel beyond that distance. So it will the respiratory droplet, when it ejects from an infected person's mouth, it will travel in a projectile motion and cannot reach there and will fall before it reaches the person. So that is why the social distancing norm has been mandated. Hand hygiene, we tend to touch surfaces unnecessarily, and that is why hand hygiene has to be put into place, so that we have to apply sanitizer or hand washing all the time, so that we ensure that our hands do not transmit the virus to another person. And last but not the least, universal masking has been proven to be effective. Excuse me. Universal masking has been proven to be quite effective in containing the spread of the virus. Masking has a science behind it, a very strong science, which is now established, and a lot of case studies has been done to understand its efficacy. And in fact, in a recent interview of our health minister, he suggested universal masking to be a social vaccine, something that works extremely well in closed public settings, or in crowded settings, or in public settings. So universal masking is something that we should all follow and give its due importance while we are going out, or while we are with other people in the same room. Let me talk about universal masking and focus on universal masking for now. So if we look at the type of masks in pre-COVID times, so pre-COVID times, the market was very different than post-COVID, or during COVID times. So if you look at the market in pre-COVID times, there were mainly three types of masks. And these types of masks, common people were not aware of. These were only used by either lab technicians or professionals or scientists or medical doctors, medical staff, etc. So basically, knowledgeable elite group of people used to use masks. So if I can categorize, so the first one being the surgical mask. So surgical masks are loose fitting kind of masks, which gives a very loose kind of fit, and has a low level of filtration, about 80% filtration. Then comes the N95 mask, which gives a better protection of about 95%, and also gives a snug fit because of its shape. Also, there is another high-end mask, N99, which gives a 99% filtration as well as giving us a snug fit. But the similarity between all these three types of masks is that these are non-washable, and they are meant for use for a typical amount of time. For example, surgical mask can be used for a period of about 8 hours, and then it is required to be disposed of. N95 mask and N99 masks can be used for maximum of 80 hours, and then it has to be disposed. So these are all single use masks having no washable or no reusability factor associated with it. Now, let us understand why is it so. It is because these masks are normally made of non-woven polypropylene fabric. And this polypropylene fabric in its non-woven form is not normally washable. So why is it not washable? Because it breaks the integrity or the structural geometry of the fabric once it is washed, because these are very fine fibers which are not exactly bonded in a very strong manner. So when you wash it, the filtration capacity goes down drastically. And normally these masks are made of a sandwich kind of a layer, in which there are one melt-blown layer sandwiched between two spun-bond layers. Now let me explain what is melt-blown and spun-bond. These are types of non-woven polypropylene fabrics. So non-woven can be classified into many categories. So spun-bond is one of them, and melt-blown is another. In melt-blown, the difference between melt-blown and spun-bond is melt-blown fibers are much finer, and therefore the pore size between two fibers is much lesser, and therefore it aids in much higher filtration. So the melt-blown layer is typically the filtration layer. The spun-bond layer is the kind of a supporting layer. And in N95 mask, to give it that particular shape and that particular rigidity, a PET layer or a polyester layer is normally added. So this was the structural geometry of the disposable type of masks, which were mainly based out of non-woven polypropylene fabric. Now let us understand the physics of filtration a little bit. So while we are talking about filtration, we are not only talking about mechanical sieving or removing the particles or the virus particles or pollutants for that matter by a mechanical sieving process, by something which separates out the particles from the inside of this mask. This is not how masks work. Let me give you a small example. So we have the basic sieve or the chutney that we use at our home to separate the tea leaves from the tea, right? So this is not exactly how masks work. Masks are something has a scientific component behind it. I'll explain to you what it is. So let us first understand the size of the SARS-CoV-2 virus. So any virus particles, including SARS-CoV-2, falls in this range 60 to 140 nanometers. The average, let's say 100 nanometers. And the filtration efficiency of even a 95% filtration or an N95 grade masks is measured at 0.3 microns or 300 microns. So the mask is being examined at 300 microns and is suggested to be capable to filter 95% of particles at 300 microns. Now the size of SARS-CoV-2 is only 100. So how does it filter? Now, there are two aspects to this particular problem. So whenever this respiratory droplets or aerosol or nuclei comes out from an infected person's mouth, when he's breathing, coughing, talking, speaking, etc., etc., does not escape as a single virus particle, but is escaped as a cluster of virus particle which is encapsulated within saliva. So whenever there is a cluster of virus particles, the particle diameter or the average particle diameter increases and becomes 0.8 to 10 microns, which is much higher than the 0.3 microns at which N95 masks are being tested. And there is another aspect to it. For this, let us go a little deeper. Let us now categorize the size of the particles escaping from the mouth, for example, let's say 10 microns, into two categories. There will be different types, there are different sizes of particles which escapes, right? So let us categorize that as less than 5 microns and more than 5 microns. Less than 5 microns particles are very small, lightweight, and can travel in a zigzag way. So if you look at the schematic given on the right side of the slide, so the red is one thread and the yellow is the other thread. So this is like two threads interacting each other at perpendicular. So this is the fabric. And the particle that you see is depicted by that black circular shape. So for particles which are less than 5 microns, they follow a diffusion path. Because the particles are lightweight, they can travel in a zigzag way. They travel and then becomes attracted to the fiber. So this is something that normally happens when the particle size is very less. Let us see what happens when the particle size is more. When the particle size is more than 5 microns, of course, this has capacity to filter out 300 nanometers or 0.3 microns. So this gets intercepted between the two threads of the fabric. Otherwise, if the particle is larger than that, it has an inertia. So the particle is heavy, it is traveling, it will have inertia. So it impacts the thread, or it kind of gets attracted to the thread and remains attached to the thread, which is called inertial impaction. So interception and inertial impactions are the phenomena which happens with particles which are more than 5 microns, and diffusion happens for particles which is less than 5 microns. There is also another phenomenon attached to it, which is electrostatic attraction. Sometimes the fibers are given a positive charge or a cationic charge. And normally viruses or microbes have a net negative charge. So there is an electrostatic attraction between both the fiber and the virus, for which the virus gets attracted to the thread and remains there. So these are the kind of filtration mechanisms that happens when we are talking about masks. Now, This grades of masks were already there in the market, but was it not sufficient? Let us see what happened. So let us see what are the problems associated with this kind of masks. So when the COVID-19 pandemic hit us, there was an acute shortage of masks in the market. So this non-woven based polypropylene fabric, which was used as the base material for making of the masks, the manufacturing capacity was not so high. Nobody anticipated that we were gonna be hit with the pandemic. So there was not enough manufacturing capacity. That is why there was a break in the supply chain, and that resulted in acute shortage. And that also resulted in masks being sold in the black market for as high as 600, 700 rupees per mask. When this was already being sold at that elevated price, people were made mandated to use mask every day. But these are non-washable kind of masks. You cannot use it beyond 7 to 8 days. And that's when people started washing this non-washable grade of mask due to lack of proper knowledge. And post that, when the mask was kind of very much worn out and torn, they used to dispose it off. But these are biomedical waste. This has to be disposed very carefully in a biohazard bin. But people resorted to dispose mask in open streets. In fact, it was very appalling to see masks which were biomedical waste lying on the streets out in the open with an ongoing pandemic. This was one of the saddest realities that we faced as of then. Also, this polypropylene has a very low moisture regain. Therefore, the allergic reaction to the skin of the public was something that was quite serious at that point of time. This masks relied on mechanical filtration only and physical filtration only to separate out the microbes. There were no active component, nothing that can actually neutralize that mask. Of course, this mask can trap those viruses. There's no doubt in it. But what happens to those viruses post it is trapped within the interstices of the mask on the outer surface? So that is something that these masks were not capable of. And coming from all these disadvantages, the consumer, the general public who were not quite used to masks, the requirements of the general public came up. In addition to having a good fit, adequate filtration, and being comfortable, breathable. So these are the gold standards while we are choosing a mask: filtration, fit, and comfortability. The other factors also crept in because masks were made mandated to be used every day. They has to be washable, reusable, so that each mask or single piece mask can be used for a period of at least 1 to 2 months. Also, because normally people touch the outer surface of this mask to adjust it. This is something which is a very wrong practice and should not be encouraged or practiced at all. The outer layer of the mask, if they were made antiviral or something that can kind of neutralize or kind of make the virus particle impotent, that would be definitely a added booster while choosing a mask. Easy donning and doffing is of course one of them. They general public were not used to masks, and this is one of the requirements that was very necessary while they are a part of the daily wardrobe. Masks were being mandated to be used every day. And also pocket friendly is one of them. Pocket friendly being even everyone was supposed to use it. So pocket friendly became one of the other requirements as well. Now, when these non-woven based polypropylene fabric was in acute shortage, cloth manufacturers took a lead and started using textile clothing materials as medical textiles. So the typical kind of structure that we follow, that they followed while making a mask, is a triple layer mask as mandated by WHO. So WHO said that there should be 3 layers at least in the mask. So they made the inner layer with knitted cotton. Knitted cotton being one of the materials that we normally use in our t-shirt. Very comfortable, very breathable, and gives the skin a very good sensation as well. The filtration layer has to be there as well. So filtration layer is the main important layer in the mask, which they used to be the same non-woven based polypropylene fabric. So instead of using polypropylene fabric in all the layers of this mask, they use the polypropylene fabric only in the middle layer to control the filtration. And the outer layer, they made it variable. It can be knitted cotton, it can be polyester, it can be any other fabric that they used. So these kind of cloth masks entered the market. And post that, a huge commoditization of masks took place, which is a sad reality. So a lot of people started working in this field. A lot of people um, who did not have enough technical credibility entered the mass market. Of course, 3M, Honeywell, and the likes are the manufacturers of N95 grade masks, but there are also some textile designers who entered this space. And normally there are also masks which were not certified, not tested, not tested for filtration, not tested for any kind of functionality, that entered this market. So this gives a small this gives the wearer a small false sense of security. The wearer thinks that he is wearing a mask, he is protected, but actually the filtration mechanism or the filtration capacity is not in place. It is much lower, and therefore he is actually contaminating himself with a lot of virus particles which might be airborne around him. Now let us come to our technology and how we helped and how our masks came into the market. So this is one technology that we had been working before the COVID-19 pandemic. So we are working on active copper technology under the brand name Accure, and this technology has outstanding antibacterial, antiviral, as well as antifungal results. And we were trying to put it in place of silver. So silver is one of the most common antimicrobial agent as of now, but the toxicity issues of nanosilver is quite high. It has been well established in the prior art and published literature. Still, a lot of companies are using nanosilver. So with that aim, we try to make a technology which is as competent as nanosilver, yet safe. And the beauty of this innovation lies in the fact that this is the only antimicrobial probably which is an essential micronutrient as well. So copper, or traditional science advocates the use of copper as an antimicrobial vessel. We used to store water in copper vessels and drink it overnight. So this is the only technology which is an essential micronutrient as well as an antimicrobial component attached with it. So it is extremely food safe, and it is extremely safe in contact with human cell lines. So this was one technology that we had already developed pre-COVID times. And when COVID-19 hit us, we gave shape to this technology in the form of a product. We were able to commercialize out a mask, which is N-Safe mask, which is active even against SARS-CoV-2, apart from being 50 times reusable. So if you look at the filtration capacity of this mask, it is 99.7 at 3 microns and more than 98.2 at 3.3 microns, which is at par with N95. Yet this mask has been coated with an antiviral shield in all its layers so that it becomes self-sanitizing, so that whenever there is a virus particle coming in the vicinity of the wearer, this mask will capture it and neutralize it within an hour. So we have a technology patent as well as a design patent for this mask. So I like to highlight this result, which was done by Rajiv Gandhi Center for Cellular Biology, in which they isolated the E genes and S genes of N-Safe mask and tried their efficacy as a function of different time. So if you look at the fifth column, within 1 hour, there is a reduction of 99% of viral load of the N-Safe mask. So this particular antiviral capacity is in all layers of the N-Safe mask. Also, the outer layer is made a water repellent layer. So why water repellent? Because this respiratory aerosols travels in a waterborne fluid, which is saliva, and we wanted to make the outer layer something so that it naturally repels off that virus aerosol before penetrating. So we made a water repellent outer layer, which will, when this aerosols will hit, that will slide off and not penetrate into the interstices. And even if it does, it will also have a self-sanitizing layer in the middle layer as well as the outer layer, which is a SARS-CoV-2 neutralizing mask within a time span of 1 hour. So we have different variations of this N-Safe mask according to the market need. We have 20 times reusable N-Safe Life mask as well. The original mask being 50 times reusable. We have an N-Kids mask, and we have an N-Smile mask as well, which has a transparent window, which facilitates lip reading, typically targeted for the mute community. Talking about the COVID-19 products that we have in our portfolio, We also have a zero alcohol sanitizer. So alcohol-based sanitizers are something that is very common in the market as of now. But the problem of alcohol-based sanitizers is it just gives you a 30-second protection time window, because alcohol has a very high evaporation rate. So of course it sanitizes your skin, but it evaporates as well. So post 30 seconds of application, you are left vulnerable to infectious viruses around you. So this particular sanitizer we designed and we kind of formulated in such a way so that it becomes gives you a 24 hours of protection. So once you apply it, it starts working from 16 seconds and gives a 24 hours protection time window. This does not have any alcohol. Of course, this has one of its components as active copper. This is extremely safe. We have done huge dermatological studies with it, and it is found to be safe even on baby skin. Another product that we have not related to COVID-19, but just as a general product I would like to highlight is water containers or water bottles. So these are one of the first kind of antimicrobial water bottles in this market, in the global market. In fact, the beauty is if you store water in this bottle, the water will be free from any kind of microbes and bacteria within just 30 minutes. This is of course enabled with the same technology, active copper. So all of our products are enabled with active copper technology, which has been established to demonstrate very high efficacy against bacteria, viruses, and fungi, including SARS-CoV-2, which is the causative organism of COVID-19. So this is the current portfolio of Nanosip Solutions as of now. Apart from the COVID-19 products and the Acure range of water bottles and containers, we also have an intermediate segment in which we do extensive corporate tie-ups. So we kind of supply them with our patented nanomaterial. So we have active copper nano powder, we have active copper nano dispersion, we have padding and coating applications for textile industry, which can make the textile fabric antimicrobial and antiviral. We also have master batches, which are typically used in the plastic industry to make antimicrobial plastics or antimicrobial surfaces. We are currently having 25 plus corporate tie-ups with our intermediate segment. Uh, I would like to share another trivia. It appalls me to understand that 80 to 90% of antimicrobial technologies are still imported from the developed countries. Even though India is home to one of the brightest minds, one of the best institutions, etc., etc., still we do not have enough entrepreneurs among us to take this antimicrobial technology from a lab scale to a commercial scale. And this is where we envision us to be one of the pioneers in kind of pushing or promoting indigenous technology on a global platform. The kind of practices that we follow at Nanosip Solutions, that manufacturing, the synthesis, normally nanomaterial synthesis is quite harsh and it involves a lot of organic solvents and it involves a lot of toxicity. But we try to change that. We try to make the process as safe and sustainable as possible. We try to use food grade ingredients in making nanomaterials, and we envision to supply these kind of safe, very safe and sustainable nanomaterials all over the world as the next generation of antimicrobial nanomaterial technologies. I'll conclude this presentation with a brief introduction about Nanosip Solutions. We are a quite young startup. In fact, our revenue generation did not hit 1 year. We are supported by numerous grants by different ministries under Government of India. We are recipient of prestigious biotechnology grant as well as GST Nidhi Seed Support Scheme. We have a global reach. We have tied up as of now with 8+ international countries. We are supplying our active copper-based nanomaterial solutions to numerous corporates in India, which are leading in their respective sectors. Of course, all of our products get extensive media coverage when they were launched. So NSAFE mask being one of them, it has got huge media coverage when it was launched back in the month of May. So we are about to have 1 year of NSAFE mask very soon. So this is where we are located inside the IT Delhi campus, where currently our office is there, and I can be reached at anasui@nanosipsolutions.com. Of course, I'll put this in the chat box as well. This is our official website, nanosipsolutions.com, in which all the products I talked about is listed with integrated delivery. And I'm going to share few emails and contact number in the chat box so that we do not lose connectivity. Thank you for your patient hearing, and I'll be very happy to answer any question that you have for me now. So
thank you so much, Anastasia. It was a wonderful, comprehensive presentation that you did, and you also explained to us very clearly about the scientific advantages of using a reusable nanosafe mask. In fact, just before Mr. Vardhaman can take up his presentation, as a last mile user, I should at this point of time give a testimony to your product. I live in Bangalore. Last year, when the pandemic outbreak happened, my wife being a doctor, we were very sensitive, and we were using only N95 masks in the beginning, including my children who were there abroad. We used to send them consignments from here for them to use N95. And one fine day, thanks to Balamurugan, your distributor in Chennai, Bala, whenever he evaluates a product and gets into his business, he does a lot of scientific research and due diligence on the product. In our group, he started circulating nanosafe brochures. All of us went through it. A lot of positive reviews happened. And in fact, in Bangalore, I ordered a few masks from Bala as a test purpose in the beginning. From day one, we were finding it very, very comfortable to use, all our family members. And the breathing kind of a situation in N95, when you travel along with a mask, we used to be having that kind of a breathless situation also when you wear it for a longer period of time. As a user, let me tell you, it was not at all a problem using N-safe masks. And the comfort level was there. And basically, not only the physical comfort, the mental comfort also over a period of time grew. Then we started subsequently ordering more masks from Bala because we wanted to have spares. And nowadays, if you go to see, whenever I travel, whenever I am going out for a simple household work or to business travel, I always use N-safe mask only. In fact, this is the way I store the mask also in a Ziploc bag. Just I thought as you were doing the presentation, I'll take my mask and show people also in our group. And it's very, very comfortable and safe to use with a nice safety clip on top. And you just wear it and pull it down, and that's it. There are no gaps on the side. There are no gaps below. And as she explained, scientifically, it is very, very safe with lot of, they know it better. And it is very nice today that the founder herself was here to explain about the mask and the product. And I strongly recommend all our friends also to go in for the mask. And of course, we are yet to try the sanitizers and the water bottle, which we are going to do. Thank you very much, and God bless you.
thank you. Let me just emphasize one small point here. While we are all choosing a mask, we should be utmost we should bear in mind that the gaps or the air gaps should be neglected, should not be there as much as possible. So our mask is one of the masks which has a design patent as well. So the elasticated chin band that you see is one of our components in the design patent. So you will see no other mask in this market which has an elasticated band in the chin region. And the elasticated band there ensures that there is no gap in the chin region, which is kind of there in some of the masks in the market. So if there is a gap here in the chin, the mask really does not serve its purpose. This is a small information that I wanted to give from my side.
Yeah, sure. I think there are a lot of questions and clarifications also coming up in the chat box, which we will address after Vardhaman's presentation, so that we collectively open up the mics and ask our members also to interact. Gopi, shall we go ahead with Vardhaman's presentation and then take up the questions? You're on mute, Gopi.
Yeah, we can go ahead.
Yeah, sure. Thanks. Over to Vardhaman. Please go ahead.
Yeah, thank you, Mr. Kamal, and thank you, Mr. Gopi. Can you just confirm if you can see my screen?
Yeah, we can.
Okay, so hello and a very good morning to everyone here. Let me begin with thanking Mr. Gopi and Mr. Balamurugan and the entire organizing committee of AABN for organizing this business networking event and also giving us this opportunity to be able to come here and get in touch, interact with this esteemed alumni of Annamalai University. So thank you. Next, let me also thank Dr. Anusuya for giving us these invaluable insights on the pandemic and introducing this very special and safe mask. So I am also, like Mr. Kamal, going to order my mask after this presentation. But apart from the mask, so what I'm here to talk about is that the mask is a very effective defense mechanism when it comes to fighting this virus. But apart from the mask, because this virus is invisible and also very deadly, it is also extremely important that we have mechanisms which can help us fortify our environment, have security measures to make sure that the virus is not able to reach us itself. And even in case it is able to reach us, we minimize the chances of it being able to reach us. Right. So this very fort that I'm talking about is UVC. So UVC is known. Uh, it is known that there are no pathogens or even the coronavirus which are able to breach UVC. Right. So this is not something new. It is an old technology. It is being used for more than 40 years globally for various disinfection and germicidal purposes. And Signify, earlier known as Philips Lighting, is a global leader for more than 35 years when it comes to the UVC technology. So let me take you through the contents. How have I structured this session? So to begin with, we'll talk about what is UVC and how does it work. Next, we look at what are the different applications where UVC can be applied to provide or make the environments safer. Next, we'll talk about the safe usage of UVC, because there are harmful effects of UVC, and hence it is very important to look at how do we build the products and how do we even deploy them in environments to make sure that they are being used safely. And then we move on to the Signify India offerings that we have for professional use. So what is UVC? So UVC is nothing but it is a part of the electromagnetic spectrum which is being radiated by the sun, right? And when we talk of the electromagnetic spectrum, it is divided into various bands, as you can see here on the screen. The visible spectrum is the one which helps us see the world around us as it is, which is from about 400 to 800 nanometers. The infrared spectrum is the one that we feel in the form of heat when we step out in the sun. And then there is this ultraviolet spectrum, which ranges from 100 nanometers to 400 nanometers. And even this spectrum gets divided into three categories basis on the kind of usages. UVA and UVB are predominantly used for medicinal and pharmaceutical purposes. But our topic of discussion and focus here today in this session is going to be UVC, right? So which is the one which is responsible for the germicidal and disinfection properties that it has, and it is being used for the past so many years. So 200 to 280 nanometers in this 100 to 400 nanometers band is the UVC. Now, how does UVC work, right? So this basically works by breaking the DNA of the microorganisms. So breaking the DNA and RNA of the microorganisms when these microorganisms are exposed to UVC. There is no known microorganism, like I said, be it a bacteria or a virus or any other pathogen, which is till date resistant to UVC. That is, every microorganism responds to UVC, and UVC is able to inactivate every known microorganism today. Now, like I said, this is an old technology. It has been used for more than 40 years. And where we would have used it, where most of us would have used it is, so 8 out of 10 RO purifiers that would be there at our homes would be carrying a UVC lamp from Philips, which is used for disinfection of water, right? So the predominant usages of UVC are disinfection of water, disinfection of air, and disinfection of surfaces. Now, another important thing to understand is, so we know that it can break the DNA of the microorganisms and make them inactive, but how effective is UVC? So UVC, like I said, is an entire band from 200 to 280 nanometers, right? But this peaks at 265 nanometers. You can see here that there is a peak at 265 nanometers. Now, the closer you are, or the closer your light source is to this 265 nanometers, the more effective will the UVC be. And like you can see that this curve is an exponential curve. So it falls very steeply as you go towards the left or as you go towards the right. And hence, if instead of 265, there is someone who is able to generate a UVC at maybe even 210, the effectiveness will just be 20%. Now, our light sources, all our light sources, the UVC light sources have a peak at 253.7 nanometers, which is 85% of the effectiveness peak, which is by far the best that is available so far globally. So that is to show how effective these light sources are. Now, having looked at how does UVC work, right? Is it the same? Does it work the same way on all the microorganisms? Yes, but the amount of time, or rather, we call it the dosage in scientific terms. The amount of dosage that is required differs from microorganism to microorganism. Dosage is nothing but the amount of time for which this radiation would fall on a particular microorganism to be able to inactivate it, right? So the dosage for a regular influenza virus would be very different from the dosage of a hepatitis virus, which would be very different for the dosage which is required to inactivate a particular bacteria. And based on the situation, or based on the application, we can decide on what kind of dosage would be required to cater to that kind of an application. How is the disinfection rate measured? It is measured in terms of a unit known as log. So log 1 disinfection means 90% killing rate. So if I look at a log 1 disinfection rate for a particular microorganism, that would mean that in that particular time or with that particular dosage, UVC will be able to reduce 90% of the microbial load which is available in that particular environment. Similarly, 2 log is 99%, 3 log 99.9%, and so on. So very happy to share that our light sources have been tested and proven to be effective in inactivating SARS-CoV-2, which is the virus that causes COVID-19. And it is in fact only the Signify lamps so far with whom these tests have been conducted and results have been released. We did this press release in June 2020, and we did this in association with the National Emerging Infectious Diseases Laboratory in Boston University, right? And these tests showed that with our lamps, we can inactivate SARS-CoV-2, which is the virus that causes COVID-19, to the extent of even 5 log or 6 log, which is 99.5 times 9%. So that shows how effective the light source is when, and it is only our light sources that we use in all our products, and hence how effective the product is, and it will be able to achieve the disinfection rate that it is supposed to achieve. Coming to the applications, now the applications would basically stem from the modes of transmission. Dr. Anusuya already explained this in detail. So there are direct and indirect modes of transmission. Direct is when a person who is coughing or sneezing or even talking to someone within 2 feet or 3 feet of distance, he directly transfers it to the other person. What we address here with our products is the indirect modes of transmission, right? So there are two indirect modes of transmission. Dr. Anusuya also talked about surface transmission, so wherein the transmission happens from objects. We happen to hold certain objects, someone else holds it. We happen to touch certain surfaces, somebody else touches those surfaces and ends up getting the virus from those surfaces. This is surface-based transmission. And then we have airborne transmission, which happens through droplets which are suspended in the air and remain in the air for quite some time and are inhaled by people who are there in that environment. So these are the two important modes of transmission, the indirect modes of transmission, that is the surface and the air transmission, which we address with our products. The applications, so applications would span across different environments. I would say every environment that is an indoor environment which has a high density of people. So we talk about retail, that is the retail chains. We've already done a lot of big global retail chains. We are also in discussion with a few retail chains here in India to be able to implement our solutions. Education, very important, because this is the future of India that is getting groomed in these classrooms. So in India, if I talk about, we have done, you would have heard of these Allen coaching classes, which coach students for IIT JEE exams. So we have done their centers with our products. Healthcare, a very important segment, because there is always a high risk of hospital acquired infections when we happen to visit a hospital. So in terms of hospitals, spanning right from Tamil Nadu to Telangana to Maharashtra to Delhi, we've done a number of hospitals, to name a few, AIMS, Safdarjung, National Institute of TB, and many more in other parts of India. Other places would be restaurants, offices. We are also doing offices of a lot of IT majors, both surface as well as air disinfection using our products, hotels, malls, and public places like airports, metros, etc. So we can deploy this disinfection, like I said, in any indoor environment. But another very important thing that comes along with manufacturing these solutions and deploying these solutions is the responsibility to make sure that they don't harm anyone, right? So UVC, if there is a person who is directly exposed to UVC, it could be very, very harmful when it comes to skin exposure and eye exposure. And hence it is extremely, extremely essential that while developing these products, and even while deploying these products, there are enough safeguards in place to make sure that we are using these products to be able to make the environment safer and not unsafe, right? So that is what we do. In terms of safeguards, we classify the safeguards into three categories. So the products get specified into three categories based on the kind of safeguards. The first safeguard, as you see on my screen, is the complete containment safeguard. So which is for products where you need a complete containment zone. That is, nobody can be there inside the environment when the disinfection is happening for that particular environment. And if at all there is a person who has to be there who is disinfecting, he has to be wearing proper PPE kits to make sure that he doesn't get exposed to UVC. Next is partial equipment safeguard. So these are the next category of products which are also meant for disinfecting the surfaces. And you cannot have anyone stepping in inside these environments when the disinfection is happening, because this UVC is basically irradiating all the surfaces in that particular room, and hence if a person comes in, there is a chance of him getting accidentally exposed. So what the partial equipment safeguard products do is that they have a secondary protection mechanism like a sensor, right? So this sensor, it detects any movement in the room, it detects anyone stepping inside the room, and switches on and switches off this product so that there is no accidental exposure that happens to the person who enters the room. And then is a complete equipment safeguard, so which is majorly for the air disinfection products, so wherein you can continuously use these products even in environments where people are present. So if there is an office in a full-fledged working office, you can deploy all of our air disinfection solutions 24/7 to keep the air completely disinfected from COVID and from any other pathogens, airborne pathogens for that matter. So that is complete equipment safeguarded products. So very important, like I said, to make sure that when we make a choice of buying these products, they are from a responsible manufacturer who is taking care and who is aware of all of these safeguards. So next, let me come to the UVC offerings. Like I said, three categories: air disinfection, surface disinfection, and object disinfection. And then we have UVC services, which also I'll talk about in brief. So wherein we offer disinfection as a service for your offices. So a little bit of a few facts about this pandemic, and Dr. Anusuya has already talked about them in detail. I'll not go in detail, just touch upon a few facts which are important to understand as to why is air disinfection so important. So when this pandemic began, it was initially propagated that it majorly spreads from surfaces and it can survive on surfaces for up to 8 to 9 days, right? But as time progressed and as more and more studies were done, WHO acknowledged in July 2020 that COVID is also airborne and it spreads through air. As latest as the last Thursday, there was a study which was published by the Lancet Scientific Journal, showing that saying that air is the predominant medium of transmission when it comes to COVID-19, and so much so that long range transmission. So long range transmission is between people who are not even there in the same room. So for example, take maybe two people sitting in different rooms in a hotel, and it has been found from these studies that a person sitting in a different room can also get infected from a person from an affected person who is sitting in the other room and breathing out this virus in the air. Silent transmission accounts for more than 40% of the transmission, right? So there are a lot of asymptomatic cases. In fact, there is a good percentage of cases in this disease which are asymptomatic, wherein the person himself doesn't know that he is affected, and he is amongst other people who are not affected in an office or any other environment. And what happens in an office is you see that when people are typically sitting together for 8 hours, 10 hours together, there would be times like coffee breaks, lunch breaks, meal breaks, etc., when you would not be wearing the mask, and that is when this transmission has a high chance to happen, because the other people don't even know that the asymptomatic carrier is carrying the virus. And hence it becomes, given today's situation, I mean, we have 2.6 lakhs cases happening in a day. I think more than 1,500 deaths that happened yesterday. I think it is extremely important that we start taking all the measures which are required to be able to curtail this airborne transmission, and that is where these products of air disinfection really come in. And this is not only COVID-19 specific. I mean, there are so many pandemics which have happened, and Dr. Anusuya also talked about so many pandemics like the Spanish flu, etc., which have happened. And there are so many other airborne diseases like influenza, tuberculosis, chickenpox, measles, SARS, MERS, which are highly contagious and transmitted through air. So this is not something which is COVID specific, but if you have air disinfection measures, they can really help in bringing about general well-being of the people who are there in those environments, even in the long term. So where, like I said, any indoor environment could be a use case for this, which has high density of people spanning from government to private offices, banks, schools, very importantly, the hospitals, even public places like airports, metro stations, malls, gyms. So in fact, we have been doing these projects with a few airports as well as metro stations as well to disinfect the air in these public places, because These are places which are very crowded, and these are places which involve a lot of people using them. Coming to the products, so the first one is the upper air disinfection unit, and as you can see on the top, this is a product which has been proven to inactivate the SARS-CoV-2 virus within a particular room to the tune of 99.99% within 10 minutes. And also in this study, below 20 minutes, it was found that the virus was below detectable levels, hence extremely effective. The other way that we look at improving the air quality of the room is having a good ventilation. So if you talk about a typical air conditioned environment, the ventilation is measured in terms of ACH. Those of you from the air conditioning domain would know about this, which is the number of air changes per hour. A typical air conditioned environment has about 3 to 4 air changes at max. And with 3 to 4 air changes, if there is a particular microbe which is there in the air, it would take about 2.5 hours to be able to reduce this virus by 99.9%. Whereas when you use an upper air disinfection unit, the number of air changes, or the number of equivalent air changes, I would say, because this will not circulate the air, but the rate at which it would disinfect leads to an EACH, as they call it. So equivalent number of air changes goes up to as high as 18 to 24, which helps in reducing the microbial load in that particular environment by 99.9% in a span of about 25 minutes. So that's how effective this solution is. In fact, this is also a solution which has been recommended by WHO for prevention and control of highly contagious airborne diseases like tuberculosis. A few other features about this product. So we have wall mounted and ceiling mounted units, as you can see on the screen. Enhanced safety, because this is a product which would be installed, like I said, in environments which are already functional, in offices which are functional, and there are people in that environment, and hence it is extremely important to design the product in a way that there is no exposure of the person who is there in this environment to UVC. So what is done here is that we have specially designed 0% reflective, that is completely non-reflective louvers, which will not reflect the UVC at all. And it creates a zone, a disinfection zone parallel to the ceiling, and disinfects the microbes in this particular zone. So there is absolutely no chance of exposure to UVC for any person who is there and working in that environment. So which makes it completely safe, and it is very easy to maintain and very easy to install itself. It has a large coverage area, so one unit, whether it be the ceiling mounted or the wall mounted unit, one unit can address up to 200 square feet of area. Next is the air disinfection unit, and we might wonder that when we have the upper air disinfection product, why this air disinfection unit? So the upper air disinfection product is meant for places that have a minimum amount of ventilation, that is something like maybe an environment in which an HVAC system is deployed, or an environment where there is a sufficient amount of ventilation that is happening. But there are environments where we don't have sufficient amount of ventilation. So the air, since the air will not be circulating, it becomes very difficult to disinfect the entire air, right? So this product, how it helps is it creates circulation of the air in a particular room by using a motorized fan. There is a motorized fan inside this, which will suck in the air from the environment, direct it to the UVC disinfection chamber inside, and then circulate that air back to the environment. So in the studies that we've conducted in the lab, this product is also able to bring down the microbial load in a particular environment where it is deployed by 99.9% in a matter of 20 to 25 minutes, right? Apart from this, another very important feature is that all our products are completely no ozone products. There is zero ozone emission from any of them, because a lot of time the UVC lamps come along with the ozone emissions. None of our UV lamps have any ozone that is getting emitted from them. Ozone is poisonous to human beings when inhaled, and hence you cannot have a UV lamp which is emitting ozone. All our lamps are completely ozone free. There's a very user-friendly panel here, which has a timer, which has the fan speed setting, which has a child lock and the power on and off button. And it is also very easy to maintain. I mean, which anyone, you don't even need someone skilled to come down there and maintain this. Anyone can easily just remove the lamp and change the lamp if there is required. There is a failure notification which is there in the product in case any lamp fails, and you can even easily take out and change the driver if required. So very easy to maintain as well. Now, third and very important offering is also this is known as UVGI, which is ultraviolet germicidal irradiation for the HVAC units, right? So, uh, like I said, those of you who are from the HVAC industry would know about this, but just to give you a little brief of how the process of cooling and filtration happens in the HVACs. The diagram here is of a typical AHU, an air handling unit. The objective of an air handling unit is to filter out the contaminants from the air and to bring down the air to the temperature which is required in a particular environment, and then circulated back into the environment. So as you see here, that when the air travels through various filters and comes to the cooling coil, it is cooled and then supplied back to the building. But what happens here is, although these filters are able to filter out a lot of particulate matter, they are not able to filter out a lot of pathogens and microbes which come and settle on the cooling coil. And this cooling coil being humid because of the condensation that is happening because of the cooling effect that it does to the air, and also AHU being a completely dark environment, the cooling coil is a very favorable breeding ground for the microbes. And these microbes, their colonies, they multiply. Once they are settled here, they multiply and grow and form a thick biofilm. I mean, that is something that you can see if you check the AHUs of your offices. There is a thick biofilm that develops on this cooling coil, so which also starts acting as a source which contaminates the indoor air, and also brings down the indoor air quality. So this unit that we use here, the UVGI unit that we use here, is irradiating this cooling coil continuously. So how does it help? When this is irradiating the cooling coil continuously, there is no chance of any microorganism being able to grow or survive on this cooling coil, and hence it keeps the cooling coil clean and avoids any contamination of the air that happens because of this growth on the cooling coil to the environment. Another important advantage also is the efficiency of the cooling coil, because when you have this thick biofilm which is formed over the cooling coil, it also reduces the cooling efficiency. So the system has to work harder, as in it has to consume more power to be able to provide the same amount of cooling. And it is seen that the loss of efficiency in case of such biofilms formed can be to the extent of 15 to 20%. And HVACs are the one which utilize about 60% of the electrical load in a building. So by using this system, you can completely do away with that loss of efficiency, and hence saving about 15 to 20% losses that you would have otherwise made. So yes, two very important benefits: to keep the coil clean, and second is to keep the system efficient. We have two versions here, the standard analog version, so which is a version where you have the controls of switching on and off the lamps. You also have the on and off indicator, so you can see for each of the lamps whether they are on or off. You have a system life indicator which shows how long these lamps have run. because 9,000 hours is the life of these lamps. So when it is approaching that life, you know that it is time to change the lamp. The digital version is a bit enhanced, so wherein you have a display for each of the lamps, whether the lamp is on and off, on or off. You have a display for the lamp life of each of the lamps as to how much of life has elapsed, and you come to know when to change the lamp. It also has capabilities to integrate to the BMS of the building, and it can transfer data like lamp life, lamp failure, and replacement alerts to the BMS, so that there is proactive maintenance that can happen using the data which is given to the BMS. So this is about the UVGI systems, and this covers all the air disinfection products that we have. Next, we move on to the surface disinfection products. The first one is a product known as the automated disinfection system, right? And this is a luminaire, a linear luminaire, as you see here in the picture, along with the sensor. How this works is, so this is predominantly for disinfection of surfaces. So you install this in a cabin, in a meeting room, in a washroom, in a conference room, in a boardroom, or any of the other indoor environments, for example, even a classroom. This is the product that we installed in the coaching class that I spoke about. You install this there, you start the disinfection cycle. There is a preset disinfection cycle which you could have depending on what is the height the luminaire is mounted at, of 30 minutes, 60 minutes, 1 hour, etc. Right? You start the disinfection cycle, but since it is UVC which is disinfecting, there is no one who can enter this area. Just in case someone happens to enter this area, this sensor which we are using with the luminaire will sense that there is someone who has entered and switch off the luminaire to make sure that there is no accidental exposure of UVC that is happening to a person. So with this luminaire, we are able to disinfect surfaces to the tune of 99.9% in a matter of about 30 minutes, and hence extremely effective in disinfecting surfaces. You would have seen a lot of these trolleys during the first wave being used in hospitals and certain other areas. So we also have these trolleys for surface disinfection. The low intensity, all the single arm and the double arm trolleys that you see on the left, and the high intensity trolley that you see on the right hand side. So these trolleys can be taken around in the office, in the hospital, or any other indoor environment to be able to disinfect all the surfaces, be it horizontal or vertical surfaces in that particular room. This is also a trolley that we use. I spoke about the disinfection as a service that we offer for offices. So this is also the trolley that we use for this service that we provide to our customers, wherein skilled technicians along with PPE kits go to the offices and use this trolley to disinfect all the surfaces in the offices. The last one, object disinfection. So in our offices, we have various objects, and we know that this virus also transmits through surfaces of objects which are belongings of people that they are getting to the offices. So it could be laptop bags, the laptops themselves, the couriers which are coming to the office, which have changed multiple hands, ID cards, mobiles, stationery, etc., which can be disinfected in this disinfection chamber. The USP of this chamber, so we have tested, and this chamber has proven effective to be able to provide 360-degree disinfection, which is extremely important because UVC basically disinfects only the surfaces on which it is incident. This chamber has been scientifically built with the placement of lamps in a way that any product or any object that goes inside this chamber gets a 360-degree exposure of UVC and is completely disinfected. And we are able to get disinfection rates of 4 log, that is 99.99%, in a matter of 5 to 10 minutes with this chamber. We have two sizes here. The smaller size, which is 66 liters, and the medium size, which is 112 liters. So that's it in terms of the products. I'll quickly take you through the disinfection as a service that we offer. So what we do here is that we have a team, we have a trained team which visits your offices, which assesses the office for its need of disinfection. Basis this assessment, they will decide on which all products would they need for the disinfection. They will disinfect the office, and after disinfection, they will also give you a certificate like the one that you see on the right top of your screen, saying that the surfaces of this workplace have been disinfected by Philips UVC lamps. So this is what we do, basically site assessment, disinfection, and certification. And we have got into contracts. We have basically two kinds of services that we offer here. We have categorized them into extreme and vibrant, and we have got into contracts with a number of offices for doing this disinfection, since UVC disinfection is extremely effective. So I think that brings me to the end of this presentation, and I would like to summarize this in 3 points. So I think the first point that I think is extremely important is the importance of creating safe environments. So let us go and look at our own environments, the environments of our customers and clients, and see as to what are the opportunities which are available to make those environments safer. Let all of us do that. Next is, after knowing where is it that we can do this, where is it that we can create safer environments, next is to choose the right products. And we saw that we have products spanning across all applications to be able to create these safer environments. So choose the right product to be able to do this. And the next one, like your video also said, is bringing everyone together. So collaboration is the key, and we would look forward to collaborate with each one of you and your firms to be able to create safer environments, and we would provide all the support that is required in terms of design, in terms of even giving proposal to your customers. Also, we have installation teams which can help for installation, and we can also take contracts of AMC for whatever time period the customer would like to get into an AMC for. So I think that's all from my side. Thanking all of you a lot for your time, interest, and attention. And I think we can now move on to the question and answer sessions. If anyone has any questions, I think we can move to that, and I would be happy to answer them. Thank you.
Thank you, Vardhaman. It was quite an insightful session once again, and we should thank our committee member Balamurugan for bringing two distinguished people from the industry to give us today's session. We can quickly open up the mics also in case people have any direct questions to ask. People, members can unmute and ask relevant questions to the respective speaker.
Yeah, Vardhaman, good morning.
Good morning, Mr. Babu.
Yeah, I seen your presentation. The presentation is very nice.
Thank you.
I have two clarification I need.
Sure.
In one presentation, one slide, your people disinfection doing UVC. There is no impact. Means then why they use the cover full body they covered?
No, so I said, Mr. Babu, that any exposure to UVC, any skin exposure or eye exposure to UVC is extremely harmful. And hence, while using products which are complete containment safeguard products, that is, you cannot have anyone in that environment while that environment is getting disinfected. When there is someone who is disinfecting that environment using these products, he has to wear the PPE kit to make sure that he is himself not getting affected by this product, because it is emitting UVC to disinfect the surfaces around.
Thank you. Another thing, in AHU, you are telling in AHU, the HEPA filter is there. then what is the necessary of this UV?
Yeah. So HEPA filter is very good in terms of filtering out the
Particles.
particulate matter, right? And also certain microbes to some extent. But this biofilm, which gets created on the cooling coil, is still a reality despite of HEPA filters being there. So which effectively means that there are microbes which are not getting filtered in the HEPA filter, which are coming to the cooling coil, and the cooling coil, like I said, itself acts as a source to help these microbes, microbial colonies to multiply and increase and form a thick biofilm, which starts acting as a source to again contaminate the air. And hence, despite of the HEPA filters also, I think there are many customers, there are airports, there are IT companies, there are metros who have already installed this, because despite of the HEPA filters, these biofilms are still a reality.
Okay. But in the pharma field, up to now, we not seen this. This is the new technique, I accept. But how it will be effective, we have to see. Can you possible to share these slides to us?
Yeah, we can pass on
Because
the
we want to
slides.
show to our managements. That's why.
Vardhaman, I will just give you a small background about Babu.
Yeah.
Babu is based at Hyderabad, and he works in a pharma company there. So
Okay.
that's why he's asking you so many questions, you know.
Yeah, absolutely. I think it is in interest of everyone that he is asking these questions, because I mean, the more we interact, everyone learns out of it. So, Mr. Babu, I will share these slides with you. And what was the other question?
That's all. That's all. It's nice. That's why we are asking. We have to show to
Yeah.
our management, because
And
disinfection
in
is
fact, even in terms of effectiveness, so we have got the pre and post tests done for the AHUs, wherein we measured the microbial load in the AHUs on the cooling coil and in the air in the AHU pre-treatment and then post-treatment, and then we could see a significant reduction to the tune of 90% within a span of 3 hours. So we have those results as well, test results from a third-party lab, which also can be shared.
Thank you, sir. Thank you so much.
Vardhamanji, good morning. This is Shailendra. Can I ask you a question?
Yeah, sure, Shailendraji. Good afternoon.
Vardhamanji, nowadays what is happening is, because of this COVID situation, most of the modern day offices, those are like, they do not, offices do not have windows. I mean, we have to completely rely on the central air conditioning systems. And because of some information, it is very popularly said that air conditions are not to be used during this time, because they are more dangerous. If somebody infected in your office because of the air conditioning system, multiple people can get infected. And in such situation, we are relying on table fans. And the thing is, there is no source for fresh air ventilation, because there is no window at all in the modern day offices. How do you foresee this particular situation in terms of lack of fresh air, and we are managing with the table fans? So in terms of microbial loads, do you really foresee a good opportunity for your fan disinfecting systems that you mentioned about?
No, absolutely. I think a very good question, Shailendraji, and it is very relevant to the situation today, because this is a situation that we are facing across in all the offices. There is a dilemma whether we should have the air conditioning on or no. If there is no air conditioning, there is no ventilation at all, because with air conditioning, you at least have 10% fresh air coming in. Without air conditioning, you don't even have that. So I think the measures which can be adopted here, and which are definitely getting adopted, there's an IT major in India with whom we have done about 1200 of their AHUs. We are in process of completing it with them. And this is the exact reason why they've done it, because it is really difficult to have big offices without air conditioning. And while table fans could be a temporary measure, but in the longer term, I don't think we could have table fans working to kind of substitute the HVACs. So one of the very important measures is that you take the security measures in the HVAC itself by installing these emitters, the UVC emitters inside the AHUs. That is number one. So which helps in containing the spread which is happening through HVACs. Second is that when you already have a circulation with the HVACs, you can install the upper air disinfection units, because these are units which will address the transmission of virus within the environment itself, and not the air which is going, because the air has to go to the AHU to be treated from this unit that is installed inside the AHU. It becomes extremely important that these are both complementary kind of solutions, the AHU solution and the upper air solution. And yes, if you decide that you should not be using an AHU, I think the best that can be done is to use an air disinfection unit, which can also circulate the air inside. But I think that becomes a little not very practical in bigger office setups.
Okay. Yeah. Thanks, Madhavan.
Shailendra, probably you can just present these two presentations to the concerned people in our office in Pune.
Sure,
Absolutely.
and Shailendra ji, and for everyone on this call, so we have our teams across India, be it Pune or Chennai or Hyderabad. In fact, Paras from our Chennai team was the one who connected with Mr. Bala Murugan and Mr. Gopi, and that's how we got this opportunity. So we have teams across India. You can get in touch with me. I will leave my number in the chat box. I'll also leave Paras's number in the chat box. You can get in touch with us, and we will lead you to the respective team members in your local cities, so that they can help you and assist you with whatever help is required.
Sure. Thanks a lot.
Thank you.
Siddharth Singh, he has raised his hand. You can unmute him.
Yes, hi, good afternoon, everyone. And I thank everyone for conducting this session. Am I audible to everyone?
Yes,
Yeah,
please go.
Yes. And thanks, Mr. Vardhaman and Dr. Nasuya, for a wonderful session. And it was very informative in these times. I was just wanted to ask Mr. Vardhaman that how does Signify recommend that a public place, maybe not just a public place in an office, recommends that Signify recommend that it has to be disinfected maybe on a regular basis, on an overnight basis, or on a daily basis. Like for an instance, if you have disinfected an office overnight, and how sooner the people can come and work under those conditions again, and what will be the cycle of disinfection? How does Signify recommend that? What is the basis of their recommendation that it has now been disinfected and people can work again? You understand what I'm talking about?
Yeah, sure. Siddharth, thank you so much for that question. And I think very relevant in these times, that when I deploy a disinfection solution in my office or in my environment, I mean, how am I very sure as to when should I start and come working, and or when would that environment be disinfected? So again, I would categorize this answer into two categories. One is about disinfection of surfaces, and second is about disinfection of air. So disinfection of air is something that is continuous, which will keep happening even when you are there inside the office. So that is something which, when deployed, you are sure that there is a security mechanism which is deployed in my office, which is continuously disinfecting the environment, and hence I am safer in this environment as opposed to the one without this solution. Second is about the surfaces. So I spoke about the disinfection services that we have, wherein we predominantly focus on disinfecting the surfaces from which transmission can happen. So like every other disinfection mechanism, be it sanitization or chemical fumigation, it needs to happen periodically. So today also we do not do a chemical sanitization every day or every second hour, right? Because that is not feasible. You need to have the office vacated for doing that sanitization. So every office has a cycle, a weekly or a fortnightly cycle, when it sanitizes or fumigates the office, right? This is something when we take the contracts to disinfect. There are also contracts where we have taken, where we have, offered twice a week kind of disinfection services to our customers, wherein we go there on Sundays and Wednesdays or pre-decided days, disinfect the surfaces, give them the certificate, and hence they can rest assured that yes, the disinfection is happening twice a week. I hope I answered your question.
Yes, yes, yes. Thanks a lot.
Thank you.
Sorry, disinfected you telling, but how will measure?
Yeah, another very good question. So our team will also carry what is called as a UVC meter, right? And UVC meter is the one that measures the dosage which has been given to a particular surface, right? So while you cannot measure the pre and post for every treatment, we know, I talked about the dosage which is required for different kind of microorganisms. We know what dosage is required for a particular organism. So if I know that I have given this particular dosage to a surface, I know that I have done the disinfection that the product is supposed to do. So that's how we measure it today with the UVC meters.
Now, how the customer will satisfy?
So
What is the confidence to him?
Yeah, so customer satisfaction, like I said, I think to Mr. Shailendra, if I talk about air disinfection, there are pre and post tests which can be done for the cooling coil as well as for the air to show as to by what amount are we able to reduce the bacterial load or the total bacterial load, yeast and mold, whatever gets measured in that test. And for surfaces, there is a sample surface which can be taken from where we can again take a swab pre-treatment, and then there could be a swab taken after treatment given in the laboratories. There are laboratories which do these swab tests. With these pre and post tests, these results can be established.
Thank you. Thank you.
I think Rohit has unmuted. Does he have a question to ask?
Gopi sir, I have another question for Dr. Anusuya. Can I ask?
Yeah, please go ahead. Please go ahead.
Yeah, Dr. Anusuya, I mean, we hear a lot about the polymeric waste and the medical waste that is being generated because of, I mean, mask is one of such source. And in your answers, you also mentioned that we have to dispose these masks, putting it into a plastic bag and then send it into the recycle waste. I mean, what are the methods of these masks being recycled, or is it a kind of an extended producer's responsibility as well that you are handling, that you're getting this mask back, something like that?
A very, very relevant question, in fact. So when this disposable kind of masks were flooded in the market, when people resorted to put this mask in the open streets, etc., etc., there was a huge number of biomedical waste pollution which kind of piled up. Then came the reusable variety mask, or the something that you can reuse and then dispose. Now, as of now, there is no protocol, or there is no standardized protocols even in the developed countries that kind of that has a standard that this mask should be taken back and should be recycled in such a format. Very recently, I had an interview with University of Borås, Sweden, as manufacturer of NSafe mask, as to how to control this situation. This is a very pertinent problem that the whole world is facing now, and tackling biomedical waste is not a very trivial thing. It requires a lot of understanding on the subject. Even when you're recycling, you have to be absolutely sure that you are not exactly cultivating the virus, because recyclability, you can only recycle fabrics and masks material when they are absolutely safe. So that is why when I mentioned how to dispose this biomedical waste, so this should be kind of autoclaved. In a medical setting or in a hospital setting, they should be ideally autoclaved to get rid of all the residual viruses and then recycled. And when you're talking about reusable masks that we use at home, we should make sure we should wash it and make sure that all kind of contaminants are thoroughly washed off before disposing it. As of now, unfortunately, in India, there is no company who is taking the masks back, who's getting hold of the masks and they can putting it to recycling. As long as there is no guidelines by WHO or some higher authority on exactly how to properly recycle them, it is very difficult for us as manufacturers to trace down the users and get the masks back to do something. But fortunately, this is something that the authorities are taking up quite seriously, and we are hoping to see a change in the coming years about recycling back biomedical waste.
Oh, yeah, thanks, ma'am.
Thank you.
I hope I'm audible now.
Yes.
Yeah.
I have a question for Vardhaman, sir.
Sure.
Yeah, so this question is regarding the AHA unit. So I believe the UFC lighting, it needs a certain amount of time to disable the microorganisms going through. So in the AHA unit, the airflow is comparatively more than when we compare it to a stagnant situation, like comparing to the ceiling one. So the doubt is like whether the UVC lighting in the AHA unit will have enough time to disable the microorganisms going through. Because I believe the time is very less compared to the other situation.
Yes, very, very good question, Mr. Rohit. So, like I said, the AHU solution serves two purposes. One of the purpose is to clean the coil itself, right? So while cleaning the coil, there is no relation with the air because coil is just a surface. So the lamps are continuously irradiating the surface, and hence cleaning the surface is not a problem at all, right? The next thing is cleaning the airstream. So like you said that yes, the time is very limited, but we can calculate as to how much dosage will we be able to give to the airstream in a single pass, right? And based on that, you can decide on the number of passes that it would take to give a particular dosage. So say if you have decided that I want to give a dose of 2000 microwatts per centimeter square to my air, right? And not the cooling coil, because cooling coil is done even with the minimum amount of illumination from the UVC lamps, because it is literally infinite amount of time that the cooling coil is getting irradiated, and it has no correlation with the speed of the air. But yes, in the air, we can make configurations with different kind of dosages which can be given in a single air pass, ranging from 500 microwatts per centimeter square to 1200 microwatts per centimeter square, depending on your requirement. And then based on this dosage, we can determine as to how many air passes would it take to be able to give the dosage that is required for that particular environment or required by a particular customer. So say suppose the customer says that I need a dosage of 4016 microwatts to be supplied to the airstream, right? If in one pass I am able to supply 1000 microwatts per centimeter square, I would say that it will take me 4 passes to be able to achieve the dosage that you asked for.
Yes, so calibration is possible for receiving.
Yeah, absolutely. Calculation is possible.
Calibration, not calculation.
Sorry?
Calibration of the dosage.
Calibration of the dosage is possible. So calibration of the dosage will happen based on the number of lamps that you are installing.
Okay,
so again, based on the customer requirement and based on the dosage requirement, it is the configuration that we would design and give you.
Okay, that clarifies my doubt. Thank you.
Yeah, thank you.
Balamurugan, would you like to? Bala?
Yes, sir.
Being a distributor, would you like to say a few words about your experience?
Yeah. That regarding that Nanosip, we are already distributing to all our AABN customer and other customer. They are really very satisfied about the product, and also they are using till date. And also this copper bottle also we are using. It is very good. And also the Nanosip, this non-alcoholic also there we are using very good results also. And also we are trying for this Ramachandra Hospital. We have got one pilot project for disinfection of HVAC. So maybe installing maybe in the next week. So after that we get the results and we can share to our group. We can get more clarity on that practically. What is the efficiency of the HVAC? So I thank to Dr. Anushya and Varadman for his time, valuable time, and present our team members. Thank you all.
Thanks, brother.
Tariq and Gopi, I'm Ashoka from Salem. Can I ask a question?
Yeah,
Yeah,
please,
please
please,
do.
please, Ashok.
Yeah, my question is to Ms. Anusuya. See, I have a different kind of contour of my face. So I get always a gap when I'm wearing the mask. Is it very risky or what kind of risk I have or how to manage this? Can you give some ideas, Ms. Anusuya?
Yeah. So may I ask you, where is the gap and what kind of mask?
Between the nose, nose, this area.
I see.
get.
So does your mask have a nose clip to kind of?
It is there, but still I get the gap.
Okay. So normally what happens, I'm thinking that you must be wearing one of those rigid type of masks, which is kind of forms a contour on your face and is not very pliable to kind of cover the surface area or the surface of your face.
Okay.
So what I can recommend is go ahead with a mask. Okay. So first things first, this gap will entail some kind of air particles to incorporate within your mask, and which is not quite recommended. So when we are talking about mask, three things are extremely important. One is the filtration, and another is the fit, and another is the breathability. So if the fit is compromised, then there is no point in using a mask in the first place. So I would suggest to go with a mask which will give you adequate fit. That's one of the primary concerns. I would suggest to go with something which is more flexible, pliable, and can sit on your face. Maybe something which is made up of cotton, or maybe something that has kind of a flexible fabric attached to it. So this N95 face mask, sometimes because of its contour, you have to put in very tightly so that it fits snugly on the face. Sometimes what happens if you do not put it snugly, these air passages can result. Which decreases the filtration. So I would suggest to go with some mask which has a flexibility and therefore can give you a good fit.
Okay. Thank you very much. And how to select a good mask? I'm going to a shop to buy a mask. How to check? What should I check before I buy that?
Okay. The first thing that you
should I go by the just like because I have a less knowledge about it? Should I go by the brand value? Or can I check with some parameters are there to check?
Well, frankly speaking, brand value in masks is a little difficult because there are a lot of textile, giants. For example, let's say Van Heusen or Alan Solly, who are giants in the textile space, and they are also making masks, but unfortunately the filtration efficiency is not taken into account. So I would suggest that rather going by the brand value, it should always be there. If the technical specification should be given more importance or more weightage. For example, the first thing to look at while choosing a mask is the filtration. The filtration at 3 microns and the filtration at 0.3 microns. Both of them are very important. So if a mask on the package, it does not have any filtration written on it, it is rather, it's not recommended to choose that mask at all. So filtration at 3 microns should be more than 99 and filtration at 0.3 should be more than 95. So that is the level that we are talking about. And apart from filtration, personal fit and personal breathability is also of utmost importance that you can select according to what suits you most. Apart from that, there are additional features. For example, you have to see whether your mask has the capacity as an antimicrobial capacity. For example, if you're touching the outer surface of this mask, are you contaminating yourself actually? So look at about the antimicrobial or the antiviral results. And last but not the least, I would suggest that go with something that has more credibility attached to it. For example, they have a Citra certification, or they have certifications from somewhere which is quite known. So that is also important.
Understood. Thank you very much.
Thank you.
Thanks, Derek and Gobi, for
Thank you, sir. Thank you, sir.
very
Thanks for being
useful
here, sir.
program. And I have a question for Mr. Vardhaman. So Vardhaman, you talked about more about the business places, okay, how to disinfect it. Is it, I saw somewhere in your presentation, at home, for home also you are giving something. Is it for air disinfecting devices or surface?
Yeah, so for home, the current solution that we have is we have a home chamber, which you would have seen. We had an advertisement running for it in the last year. We have a home chamber which can be used to sanitize, small things like fruit, vegetables, packets of breads, etc., that you get from outside. Also, this disinfection unit that I showed, the floor disinfection unit, is something which can be used at home. And there's a very interesting product that we are shortly going to come out with, which is going to be a combination of HEPA plus UV plus carbon filter, which is also something which will be applicable for home, which not only disinfects but also purifies your air. So that is something that we plan to launch in June.
What would be the cost of it?
The new one that I'm saying?
Ah.
So we have 3 variants there for covering 250 square feet, 400 square feet, and 600 square feet. The one for 250 square feet would be about 20,000 at MRP.
Continuously we can run it, is it?
Continuously, like you run air purifiers at home, you would have seen these air purifiers from many companies, which you run at home, which typically cost between 10 to 15,000 rupees based on the features. So this comes with an additional feature of also disinfecting using UVC apart from purifying. And yes, 20,000 would be the
okay. If an outsider is coming into my house, I switch on this device, whatever you said. How much will it take? How much time will it take to disinfect it? Is there any possibility to get the infected before it starts? What is it?
So this is a continuous disinfection device. So it continuously takes in air, disinfects it, and then circulates it outside. So if you ask me, if there is a particular microbial load, so there are 2 kinds of loads. One is a stationary load.
Okay.
One is a station.
Okay.
One is a stationary load and one is a dynamic load. Now you can do tests on the stationary load. I can have a particular load in a chamber and do tests on this. So with the stationary load, within half an hour, this will be able to bring down the load by 99.9%, right? But if there is a continuous load, so whenever the load comes in, you can consider in about half an hour's time that will be brought down.
Okay, thank you.
Thank you, sir.
Thank you, Dr. Anasuya and Mr. Vardhaman. Very few people can express their passion for the subject and profession so effectively. You both did an exceptionally stimulating and informative speech. Thank you very much for your time and thanks for being with us. Look forward to meeting you guys soon. Thank you.
Thank you, Mr. Gopi. Thank you, everyone. And have a nice day. Thank you.
Yeah, thank you. Thank you, Vardhaman, and thank you, Dr. Anasuya.
Thank you. Have a nice day.
Thank you, Anusha. Bye.
Vaiti, if you'd like to introduce our guest members, member introduction, we can quickly do it. Vaiti, you can unmute. I think Vaiteswaran is not able to unmute. Bala, would you like to take up the member introduction, Bala? And
yes, you can check it with the speakers, the time availability, and also.
Yeah, no, the speakers will not hold them for long. So
can we log out? You're saying?
Yeah,
you can.
You can, thank you.
Yeah, thank you.
Thanks.
Thank you very much.
Thanks, Vardhaman. Thanks, Dr. Anusya.
Thank you.
Thank you.
Thank you.
Take care.